Hey guys, Dr. Berg here. In this video, we're going to talk about the psoas, the P being silent. It's a very large muscle that connects the upper torso with the bottom part of the legs. Okay, so it allows you to stay connected. If you didn't have that muscle, you'd probably be separated. But it allows you to flex your knees up or your legs up. So it's a flexion. It brings you forward like this. Like if you were to do sit-ups and come all the way up, this is the main muscle that allows you to do that. Okay, so it connects to these vertebrae here, and it goes through the pelvis to the inside of your femur or your upper leg. So it brings the leg up and it stabilizes the pelvis. So many people have a problem with this muscle. Either it's too tight or it's too weak. Or it could be tight on this side and loose on this side. So I'm going to show you exactly how to test it and what to do to stretch it so you can get these symmetrical. I think it shows up as a big problem for people because they sit all day long, or some people do a lot of sit-ups, but you don't reverse the flow and do extensions with your back. So if you do too many sit-ups, you're going to mess this up, and if you sit too much, you're going to mess it up, and your posture is going to be kind of like this all the time. So let's demonstrate how to test this muscle. Okay, so the first thing we're going to test is we're going to test if the psoas is tight on this side or this side. And all we're going to do is, you need someone to do this, so if you're laying down, you need someone to measure, keep this leg straight, and raise it as high as you can. All right, good, put it down. Good, now do the same thing with the other side. Okay, good. Now you can see that this leg went up a lot higher. And I always ask the person, did you feel that this went higher?
Yes.
Okay, that was a yes. So what happens is that this side over here is restricted. It's tight. So we have a tight psoas on this side. Okay? So what we're going to do is we're going to stretch out. We're going to have him lay on his back and stretch this out. But this side's good, this side's not good. So we want to balance this. This is going to create an imbalance with his pelvis and cause hip pain or back pain, in which also he does have hip pain. That's probably why. So let's go ahead and have you flip over. So I'm going to have you move close to this side. A little bit more. Good. So now what we're going to do is we're going to keep this leg straight, okay, and then we're going to stretch it down like this. Okay. So this is actually pulling this thing down. Do you feel any stretch right here?
Yeah.
Now keep this leg straight and see if you can't, yeah, right there. Do you feel more of a stretch right there?
Yes.
Yeah. So what's happening, we're actually, without falling off, he's stretching this muscle because it's connected right here. And then you'll bring it up a little bit, and then we'll just stretch it. And we want to stretch this all the way down like that. That's just one way. You can do it many different ways. Okay, so let me show you another way. Scoot back. You can take a foam roller, and we can put this roller kind of up right here. Yeah, and we can keep this knee up and bring this thing down. Do you feel the stretch right there?
Mm-hmm.
So this is a good way to stretch it, but we're just stretching this, and I would actually stretch this for about 2 minutes. What's going to happen, it's going to balance out the psoas, okay? So you would, if you had a problem with the other psoas, you would just do the opposite. So we're trying to just stretch the one that is tight. Very, very simple, no complications. Okay, so now we're going to take this down. Now the next thing we're going to do is we're going to check the strength of the psoas, okay? So the psoas brings the knee up here. So it brings it up, right? So there's a couple ways we can do this. What I like to do is I like to bend this and hold this down. Resist me. I'm going to press down. Okay, I'm going to check the strength there. That's strong. So this side's okay. Bend this one right here. Resist.
I did resist.
Okay, his right psoas is weak. Okay, so if this side's weak, then what's going to happen is that he's going to throw off the whole balance. So, so again, let me just kind of summarize this. We're checking the psoas. We're going to press down and compare this side, because remember, the psoas brings the knee up, right? And then we're going to check this side. There's nothing there. Just, you can relax. Okay, yeah. So we have a weak psoas. Now, how do we make it stronger? Now, we could stretch it, but that doesn't work. What we have to do is we have to stimulate the other psoas, okay? So this is weak. We're going to stimulate the psoas on the good side. Now it attaches deep into the hip, but we're not going to press into his hip. We're going to press down in the abdomen on this side. Okay, so we're kind of working on the soft tissue that attaches to the psoas on this vertebra. So we're going to come right into here, and it's going to be a little tender. It is tender. So the two-step process. We're going to stimulate the strong muscle. It's on the opposite side of the weak one. Right through in here. That's a good one right there. Okay, stimulate just a little bit, and now we're going to recheck the muscle. You resist it. See this strong?
Actually, I'm amazed.
So it instantly got stronger. So now the other thing you could do is lay on your stomach. This leg right here, this psoas is weaker. It was weaker. Okay, so when he lifted it. So what we can do as a step 2 is we could stimulate the opposite muscle on the same side. Okay, so we can do the other psoas or the opposite muscle that does the opposite action on the same side. So if this psoas was weak, we'd work on the muscle that extends this, because the psoas flexes, so extensors are all the glutes. So we can press on the glute muscle right through in here. And this will be tender too. And we stimulate the glute right there. It's going to make his psoas strong on the same side though. Okay, good. So now let's just go ahead and re-evaluate. Keep this straight and raise it for me. Good. See how high that came up? Now the other one. Beautiful. Now raise this one. Goes up pretty high. Good. Now the other one. Okay, good. Now, do you feel any restrictions left and right?
No, it feels a lot better.
There was a slight increase on this side, but this was a lot better. So it's something that we would repeat over and over and over, but that's just an example of fixing the flexibility issues and then fixing the strength issues. Okay? So go ahead and apply this and put your comments below.